Diabetic Macular Edema. The video describes the causes of diabetes-related vision loss and how to manage this condition. The eyeball consists of three main components. 1. The tunics, which are three layers that make up the wall of the eyeball. 2. The optical components, also known as the refractile media components, which admit and focus light. 3. The neural components, which consist of the retina and the optic nerve. Most of the eye is filled with a clear gel called the vitreous. Light projects through your pupil and lens to the back of the eye. The inside lining of the eye is covered by special light-sensing cells that are collectively called the retina. It converts light into electrical impulses. Behind the eye, your optic nerve carries these impulses to the brain. The macula is a small, extra-sensitive area in the retina that gives you central vision. Diabetes occurs when pancreatic gland fails to produce adequate levels of insulin. This harms the body's natural ability to control blood glucose levels. Diabetes can lead to vision-threatening diseases such as diabetic retinopathy and diabetic macular edema (DME, which must be monitored to prevent vision loss. DME develops as a complication of diabetes type 1 or type 2 diabetes. It is estimated that approximately 93 million people worldwide have diabetic retinopathy, and more than 1 in 3 living with diabetes will develop retinopathy over their lifetime. Macular edema is caused by the result of weakening of vessel walls and increased vascular permeability. Retinal blood vessels becoming weak or blocked results in abnormal high release of vascular endothelial growth factor (VEGF), which weakens the vessel wall and blood vessels become leaky. This results in deposition of protein and fluid collect on or under the macula, which causes macula to swell and thicken. This condition is known as macular edema. Swelling of the macula causes the vision to become blurry. Colors may also look faded or washed out, and spots may appear in the vision. Anyone with diabetes should have comprehensive eye exams every year or else as recommended by their doctor. Many diabetes patients do not get their eye examined or diagnosed. If timely treatment is not obtained, then DME can lead to severe and even permanent vision loss. If your doctor suspects you have DME, you might have fluorescein angiography or FFA to look at the blood vessels in your retina. Your doctor injects a special dye into a vein in your arm. It quickly goes to your eye, where it makes blood vessels show up on digital photos. Optical coherence tomography (OCT) is one of the best ways to test for DME. It's like an ultrasound, but it uses light waves instead to create very fine detailed images of tissues inside your eye. OCT can show the thickness of different layers in your retina and find problems that other tests can't. The risk of developing DME increases with duration of diabetes, as well as abnormal levels in blood glucose, blood pressure, and blood lipids. Other diabetes complications, kidney disease, cardiovascular diseases, smoking, obesity, and pregnancy may also increase your risk for DME. You can lower your risk by controlling any modifiable risk factors you may have. Managing your diabetes and, of course, getting comprehensive eye exams as often as your doctor determines. DME treatment options are: 1. Laser photocoagulation. 2. Corticosteroids. 3. Anti-VEGF injection therapy. Laser photocoagulation, which exposes the eye to small laser burns in order to decrease and slow down leakage of fluid, stabilizing vision and potentially preventing further vision loss. However, this treatment comes with the risk of scarring the retina and unlikely to improve vision. Corticosteroids, which are received through intravitreal injection or by sustained release implants, can improve vision by interfering with the mechanisms that cause inflammation and damage to blood vessels. However, their benefits may be short-lived and comes with the risk of other eye complications such as cataracts or elevated intraocular pressure, which is a major risk factor for glaucoma. A major development in the treatment of vision loss in DME patients has been the introduction of anti-VEGF drugs. Abnormal high release of protein vascular endothelial growth factor (VEGF) in the retina, which weakens the vessel wall and blood vessels, becomes leaky, which causes macula to swell and thicken. The anti-VEGF drugs are designed to target and block VEGF. Lowering abnormal levels of VEGF reduces harmful effects on blood vessels. This decreased leakage of fluid reduces edema and can stabilize and even improve vision. Anti-VEGF treatment is received directly as an injection into the eye. There are three major responses to the anti-VEGF treatment. 1. Reduced vascular permeability so that the vessel wall is not as penetrable and leakage of fluid is minimized or completely stopped. 2. Reduction in edema and decreased thickening of the macula and retina. 3. As a result, improvement in visual acuity. Because of its positive results for DME patients and lower risk for other eye complications, anti-VEGF therapy has become the preferred treatment for DME. After the treatment with anti-VEGF injection therapy, doctor will monitor your eye from time to time, that is, weekly or monthly, and depending upon your eye condition and vision improvement, your doctor will suggest you for how long treatment is needed. It has been seen that treatment with anti-VEGF injection therapy significantly improves visual qualities such as color, brightness and sharpness, and several day-to-day activities like reading, watching TV and driving, which ultimately influences quality of life. Healthy lifestyle and dietary changes to prevent diabetic macular edema include controlling your blood sugar, performing regular exercise and maintaining healthy weight, quitting smoking if you smoke, controlling your blood pressure and cholesterol level.